Okay, is there any ill feeling against the governor of Texas, Governor Abbott, because some people might say he opened up too early?
Great question. Listen, simple deductive reasoning, I think, debunks this myth that reopening is what causes spikes. Okay, we reopened way back in early May. LA County, which is having some of the biggest spikes in the country, never really reopened. Okay, so what happened? Late May, we had massive protests, tons of people in the streets, and also holidays, big gatherings that people did. There's a layering effect that occurred. And of course, there was going to be spikes. Now, luckily, we've gotten a lot better at treating this disease. Our hospitals have been preparing for it for months. So we're in a much different place than, say, back in March, and where New York City was getting completely overwhelmed, didn't quite know how to treat the disease. And let's not forget, because of their policies, putting senior citizens back in nursing homes, they lost 32,000 people. And so reopening, giving people their freedom to engage in risk and confront it the way they see fit is not the culprit here. Okay, we have to have a balance, and we also have to be honest about our conversations. When you're shutting down the economy, it has huge costs, both health costs in terms of extra suicides, domestic violence, the health consequences of not being able to go to the hospital, get your elective surgeries. The schools shutting down have had massive costs. Those things seem to be swept under the table when we have this conversation, and we need to have smarter, more contextualized conversations about the costs of lockdowns.